Hi, I'm Roy Bechtel. I'm a physical therapist. I work with the folks here at Physical Therapy First, and I have my own practice at Yes Physical Therapy. I'm here with the Physical Therapy First tip of the week. We're going to be talking about knee pain. If you've ever had it, you know it can be pretty serious. It's going to make going up and down stairs difficult. You won't want to walk very far. It's going to put a real crimp in your lifestyle. There are multiple causes of knee pain. We're going to focus on just one particular cause, and that is biomechanical meniscus dysfunction. The typical way that you get BMD, biomechanical meniscus dysfunction, is by twisting on a partially bent knee. So you might be getting in and out of your car, you might feel a little tweak in your knee and it starts hurting. You might be reaching down to get something out of a low cabinet, pull the door open, you twist, and your knee gives you a little tweak. Or really any activity where you're doing a lot of twisting on your knees can cause BMD. If you'd like some more info on how your meniscus works and what's going on inside your knee and how does BMD come about, stay tuned and watch for some inside information. We'll get back together on the other side.
The meniscus is a saucer-shaped piece of fibrocartilage that fits in between the two bones that make up the knee, the femur on top and the tibia underneath. The knee is divided into two internal compartments, and there are two menisci, one for each compartment. The medial meniscus is larger and the lateral meniscus is smaller. The job of the menisci is to cushion the cartilage on the ends of the bones inside the joint from forces that are applied in walking, running, and jumping. A very nice study was done in 1999 that gave us information about how the menisci function. That study used MRI to look inside the knee and showed that the menisci move as the two bones move. You can see from the diagram that the medial meniscus moves about 7 millimeters forward and back, and the lateral meniscus moves almost 10 millimeters. 10 millimeters is about half an inch, so the menisci are doing quite a bit of moving inside your knee under normal circumstances. Biomechanical meniscus dysfunction occurs when one meniscus stops moving for whatever reason. It may be that there is a slight tear, or it may be that the meniscus moved too far and got stuck. In any case, that meniscus is no longer able to do its job of protecting the cartilage and essentially becomes a block to normal knee motion, which results in pain, and usually that pain is worse in one direction, either bending or straightening your knee.
Today, many people are suffering knee pain needlessly just because BMD is so severely underdiagnosed. Everybody wants to find a torn meniscus. Well, sometimes we just need to find a meniscus that's not moving correctly. Your friendly neighborhood physical therapist is an expert in orthopedic testing and treatment, and we can easily diagnose and treat a biomechanical meniscus dysfunction. Alright, so we're going to have you sitting comfortably. All we're going to do is put our fingers on each meniscus, one on either side of your kneecap. Here's the medial one, here's the lateral one. We're going to then just gently twist your tibia forward on each side and test that meniscus. There's the lateral one, there's the medial one, and both of these menisci feel very healthy. A normal healthy meniscus will allow the tibia to slide forward underneath it, and the meniscus itself will stay back. So to our finger, it feels as if the meniscus moves backward or retreats away. And that's how the test gets its name. It's called the retreating meniscus test. I find it to be very sensitive in finding cases of BMD. Now, we test both menisci on one knee, test both menisci on the other knee, and we'll have a good idea whether we're dealing with healthy menisci or if there's a problem in one knee compartment or the other. If we find a positive retreating meniscus test, we can easily treat it. All we're going to do is take the dysfunctional meniscus, we're going to gently distract the tibia, pull it away from the femur a little bit, create some space inside the joint, and unweight the meniscus. And then we're going to gently twist forward on that side. We're going to ask you to help us out here with a little bit of resistance as we straighten your knee slowly. Now you know resistance is futile, so don't do too much. That's good. Oh, that's perfect. Perfect. Excellent. And relax. Beautiful. After each time, we can retest the retreating meniscus test just to monitor our progress and make sure we're going in the right direction. Again, we'll do the same thing. That's lovely. All right, and we might do 3 of these, and then we'll retest and see how we do. Great. And as we retest, we should expect to find that the meniscus is now functioning normally, and you might notice that your pain level has dropped considerably and might even be gone completely. All right. Now, sometimes we have to go and do another treatment step, which is a little bit more aggressive. but you'll still be sitting comfortably, you won't have any pain. It'll actually take less time than what we just demonstrated, so it's all good. Your friendly neighborhood physical therapist can do a fine and thorough physical examination. Probably we'll be looking at your feet and ankles, your hips, your sacroiliac joints, and your lumbar spine as well, because all of those areas can contribute to knee pain. Now, once we've done the examination, we'll come up with a plan that's going to help you to keep your knees feeling good for a long time. As Consumer Reports says, if you have pain, you should try physical therapy first. You'll be glad you did. If you'd like to contact us or if you need more information, just give us a call. The number is 1-855-PT-FIRST. You can also find us on the web at physicaltherapyfirst.com, and you can find me on the web at yespt.biz. Thanks for watching this Physical Therapy First tip.